September is National Cholesterol Education Month, a good opportunity to get your blood cholesterol checked and begin the steps towards lowering it if it's too high. High blood cholesterol affects over 65 million Americans. It's a serious condition that increases your risk for heart disease. Dr. Gary Allen and Dr. Miguel Bryce, specialists at Florida Hospital Waterman's Heart Center, explain the importance of managing your cholesterol levels.
We have different components on the cholesterol. This is just the metabolism of the lipids, which is the fat, which certainly we do need certain amount, because a lot of the hormones that the body produces are based on that. So it's not like zero wouldn't be good either. But the cholesterol essentially has two main components. The total number, which is something we look after, and ideally we want it to be less than 200 on a total number, but most important are the fractions. And when we look at the fractions, there's kind of three levels. One is the triglycerides, which is the first particle that comes from the food that we just eat and goes into the blood. And then from then go to the liver, and the liver is the one who does all the job of metabolism of the fat and then redistribute it in the body. When it's in excess, and it's in excess of the bad one, then that's when it starts getting accumulated in vessels, more commonly heart vessels, then vessels on the main arteries of the body, legs, and sometimes in the carotid arteries. And then the good cholesterol. The good one is called the HDL. It's like the garbage collector. The more you have it, the better it is, the cleaner the street is going to be. In general, ideal number is an LDL less than 100. And ideally, it depends obviously your risk factors. If you're diabetic, it's less than 70. If you have prior heart disease, you want 70 or less. If you're otherwise healthy, it can be less than 130, but ideally in general, to keep it simple, less than 100 will be optimal. And the good cholesterol, we want it above 45.
Genetics and family history play a very large role in heart health, and what is a little bit challenging is trying to understand what part are genetics and what part are natural rearing exercises. And by that I mean there are about 10% of patients, for example, who have high cholesterol that have what we call familial hypercholesterolemia. In other words, their genes are just built such that no matter what they eat and however they exercise, they tend to have pretty high cholesterol. However, the other 90% don't. That tends to be environmental and behavioral. And it's a little bit challenging sometimes to separate those patient groups out, because we ask ourselves, when we have high cholesterol, it's easy to try to blame your family genetics, but we're usually not so honest about what we eat. And when you take groups of patients with high cholesterol, for example, who claim to have family history, you find that if you put them on a more strict cardiac diet, somehow their cholesterol magically improves. So it really is that overwhelming concept about personal responsibility and trying to understand, what the real modifiable risk factors are and what are the ones that are genetic. So I think once we get to that point where we're committed to our own care, male or female, and we understand what all the numbers are, then we can start to understand what the risk factors are.
The American Foundation for Women's Health has identified September as National Atrial Fibrillation Awareness Month. Atrial fibrillation, or AFib, is the most common irregular heartbeat and is characterized by heart palpitations, dizziness, and shortness of breath. We've included information on National Cholesterol Education Month and National Arterial Fibrillation Awareness Month, along with contact information for Florida Hospital Waterman's Heart Center. You'll find all of that when you click the Heart Health Awareness Story icon on our homepage at yourhometownhealth.com.